Our speaker, Dr. Manpreet Singh Bindra, Medical Director and Senior Consultant at Dr. Bindra Super Speciality Clinic and Cancer Care Center, Ludhiana, India. Dr. Bindra has rich clinical experience and his expertise lies in the field of cardiology and critical care and cancer care through homeopathy. He had presented many papers both on international and national platforms on cardiology and cancer care. He's an author of the book Clinical Homeopathic Cardiology with emphasis on pathological drugs for cardiac disease. Dr. Bindra is honored with the title Modern Clarke of Homeopathy in 2019 and had been honored with Excellence Award for his wonderful service in healthcare. He conducts regular workshops and webinars and train more than 3,000 homeopathic doctors. Today, Dr. Bindra will be discussing in detail about hypertension and homeopathic management. Hypertension is the most common and serious health condition affecting people all over the world. Hypertension puts you at risk for heart disease and stroke, which are the leading cause of death. Dr. Bindra will share his clinical experience with us. I welcome once again Dr. Bindra for this session. Dr. Bindra, you can take over the session.
Okay, once again, good afternoon. Thank you, Dr. Sita, first of all, for inviting me to this such wonderful platform, and Dr. Ritu, she was hosting the event. So all of you are practicing in Middle East countries, and I know that the scenario there will be a little bit different from the Indian, the scenario that we are practicing in homeopathy for many years. But when we talk about the cardiac disorders, so about cardiac disorders, there is a very, you can say, misconception, a big misconception amongst the general public opinion also, as well as the homeopathic fraternity also, that it may or may not be having a good role in the cardiac disorders. So today we will be talking about a very different topic, not different in terms of that homeopathy in cardiology, but in terms of that how you can manage the hypertension exclusively with homeopathy. When I say exclusively means that we are not dependent upon the allopathic drugs for the hypertension. This is a misconception amongst the people also, among the patient also, amongst the doctors also, not even in the other countries, but in India also, that some doctors and some homeopaths do believe that homeopathy may or may not be able to handle such disorders like hypertension, or if we talk about some other cardiac disorders like coronary artery disease, congenital heart disease, and many other. So what we will be discussing today, first, everything about hypertension, what we can do in this limited time period. What is hypertension? How we calculate that the patient is hypertensive or not? What are the stages of hypertension? What is the pathology? What is the pathophysiology? What are the different diagnostic criteria? What can be the approach towards the patient who is a hypertensive patient? Plus, what is the role and scope of homeopathic pharmacodynamics? Now, when we talk about pharmacodynamics, so what is basically pharmacodynamics? That what medicine you are prescribing to the patient. The same materia medica, the same medicines, the same drugs, everywhere across the globe. Homeopathy we are using in more than 120 plus countries now. And what medicines we are using, we all are using the same medicines. Might be, many of you might be using Veratrum album, Conium maculatum, Revolvia for hypertension in your practice also. But what we need to study nowadays, what exactly the medicine action is on the patient. I request everybody, please mute yourself. What medicine is acting on the, how it is acting on the patient's body and how the patient's body is reacting to the medicine. This is the two phenomena. What we do, pharmacodynamics, and second is the pharmacokinetics. And whole allopathic system is explaining each and every drug on pharmacodynamics and pharmacokinetics. An allopath will be prescribing Disprin to a patient for headache. And they will tell you that what happens when the patient takes the Disprin, where it will go, which system will be targeted, what brain center will be targeted, what will be the action of the medicine, how long it will take to act, everything they will tell you till the time the medicine is out of the system, either through the urinary tract, through the absorption in the circulatory system. And allopathic medicine, they have this detailed phenomena for each and every medicine. But in homeopathy, what is happening? Why we people are being targeted nowadays by the scientific community? I will say the so-called scientific community, because basically they are not the scientific ones. They are the people who want to target the Hahnemann system, the homeopathy. So we know when we give Retrum album to a patient, when we give Revolfia to a patient, what exactly happens inside the body, that it lowers down the blood pressure. This is the need of the time, because in my all webinars, in my all workshops, conferences, I always emphasize on this, that whatever you are doing, there should be reasoning for that. If I give this medicine, how it will act? The patient can ask you. A doctor can ask you from the other fraternity. And in our country, particularly if I talk about in India, we are being targeted every day for it as a placebo medicine. But when you speak with your results, plus you have a scientific explanation of each and everything what you are doing in your practice, then nobody can challenge you. So today we will start with the hypertension, a very different topic in a different perspective. So first I will just polish your knowledge, because I know that all of you are practitioners and you all know that exactly what hypertension is, but I will just try to polish it. So first about the introduction and epidemiology. So what is blood pressure? The very basic question, what is blood pressure? So blood pressure is what? It is the force which is being exerted by the circulating blood, because we all know the blood is circulating throughout the body from the heart. The force which is being exerted by this circulating blood against the walls of the blood body's arteries and the major blood vessels in the body. This is what we measure through the different locations, through the different arteries, and that is known as the blood pressure. So blood pressure is written in two numbers. One is the systolic, which represent the blood pressure in the blood vessels when the heart contracts. The contraction, the systole of the heart, cardiac cycle, what we call. Second is the diastolic one, which represent the pressure in the vessels when the heart relaxes or rests between these beats, what we call the diastole. So systolic blood pressure, what we call the upper blood pressure. Second is the lowest one, that is the diastolic, what represents the resting phase of the cardiac cycle. So now hypertension is diagnosed when it is measured on 2 different days. Always remember, somebody comes to you, your clinic, and the blood pressure is 140/90. That is the first reading that you have taken. And the patient tells you that I never had this reading in my life till now. So that does not mean that this patient is hypertensive. You need to take another reading on another day to verify it. And when the both of the days, the systolic blood pressure reading on the both days is more than 140 mm of mercury and the diastolic is more than 90, then you will diagnose that patient as a hypertensive patient. So this is a very important thing, because many factors in your lifestyle are there which can increase the blood pressure for certain moments. Anxiety can be there. Some stimulant might be there. The patient might have taken like excess of tea, excess of coffee, beer, soft drinks, alcohol, anything can be there. So that does not mean that the patient is hypertensive. So you just need to review it for 2 different sittings, and then you examine, then you evaluate accordingly, and then we diagnose the patient as the hypertensive. Then we talk about the number 1 health related risk factor in India. I'm talking about risk factor. Now see, blood pressure is basically directly not creating an impact on the health of the people. Many people are there whose blood pressure remains 150/90, 160/110 throughout the day, but they don't die. What happens? The secondary manifestational effects, the complications, which is being mediated by the blood pressure or the hypertension on the other organs of the body, that is the cause of mortality and morbidity. So in our country, in India, 1.6 million deaths annually due to ischemic heart disease and stroke. Only 2 major death causes: ischemic heart disease, myocardial infarction, Second is the stroke. Brain hemorrhage is what we call. 57% of deaths related to stroke and 24% of deaths are related to the coronary heart disease, and they both are related or secondary manifested by the hypertension. So this is the related risk factor which is causing a huge impact on the morbidity as well as the mortality in the society. So hypertension is one of the commonest non-communicable disease in India. So it is having an overall prevalence of 29.8% and a higher prevalence in the urban people, 33.8%, according to the recent epidemiological studies of 2020. So urban population is more impacted by this due to the lifestyle. Now, why it is a modifiable risk? We always say that certain diseases or certain disorders are modifiable, which can be prevented. And nowadays we have another branch of medicine in the cardiology, that is the preventive cardiology. So they just work on these modifiable risk factors, which can prevent a deep impact on the cardiac tissue. So hypertension is a major modifiable risk factor for the cardiovascular as well as the renal disease. Heart and kidney, these are the two organs which will be always having a huge impact by persistent blood pressure of any patient. And we see in our day-to-day practice, coronary artery disease, peripheral artery disease. Then we talk about the chronic kidney disease, the renal failure. So why is it happening? Why the urban population is being impacted by this? Because they are having the prolonged history of hypertension. An improved detection and the treatment of hypertension in India would reduce a preventable burden of cardiac, that is congestive heart failure, coronary artery disease, and the cerebrovascular, that is the ischemic and the hemorrhagic stroke, and the renal, that is the chronic kidney disease related to hypertension. So if we just simply reduce the intensity, the severity, and the incidence of this modifiable risk factor, that is the hypertension, we can prevent approximately 150,000 deaths annually in our country. Particularly, I'm talking about India. So only 2 mm population wide decrease in the systolic blood pressure graph in India, that will be able to prevent 151,000 deaths due to coronary artery disease and 153,000 deaths due to the stroke. So overall, approximate 3 lakh patients can be saved if you just prevent the risk of this blood pressure, and that is a modifiable one. Then we talk about measurement of blood pressure. We all know how to measure blood pressure. The systolic one is there and the diastolic is there. The systolic blood pressure, I earlier told you, it represents the blood pressure in the blood vessels when the heart is in the systole, that is the contraction of the heart. Diastolic blood pressure is representing the pressure in the blood vessels between the heartbeats, that is the diastole. Mean arterial blood pressure. Now this is a new term, MABP, mean arterial blood pressure. This is what? It is another method of assessing the blood pressure. So what is mean arterial blood pressure? The cardiac output plus or into the systemic vascular resistance. How you calculate it? The systolic blood pressure and diastolic. There is one another term, that is the pulse pressure. Now see, 3 terms are there. One is the mean arterial blood pressure. Then we have the pulse pressure, and then we have the diastolic and systolic. So what is pulse pressure? Pulse pressure is basically the systolic blood pressure minus diastolic blood pressure. Suppose somebody is having 140 by 80. So 140 minus 80, 60 is the pulse pressure of the patient. So what is the formulation of this? Mean arterial blood pressure is equal to diastolic blood pressure, like it was 80, plus pulse pressure, that was 60, divided by 3. So this will be telling you the mean arterial blood pressure of the patient. Generally in our day-to-day OPD procedures, OPD practice, we just see the systolic as well as the diastolic. The mean arterial blood pressure, the pulse pressure, they are the part of the ICU setup when the patient is into the coronary cardiac care unit. So then we talk about regulation of blood pressure, a very important topic to be discussed, because I told you that whatever you do, there should be question for everything, that why. I am saying blood pressure, systolic is this, diastolic is this, but why this much is systolic and why this much is diastolic? This is what we call the pathophysiology of the blood pressure. So now blood pressure can provide insight into the workings of the heart and the vessels of the body. So how it is controlled? Because see, the nature, the Almighty has designed our body into such a beautiful way that for every minute functioning of any particular system or a cell, there is a complete mechanism. And not only one complete mechanism, but for every complete mechanism, there is a backup plan also. Like when we talk about the coronary artery disease, the blockage in the heart coronary arteries, what we see, once somebody has the blockage in the heart arteries, what happens? There are the small blood vessels, small coronary micro vessels being generated without any effort by the patient. The collateral circulation, what we call. And when you go for the angiography of the patient, what you see? There is a collateral circulation. And that is such a beautiful way of second backup of the system. If the coronary artery is blocked, this is the first backup. So when it is blocked or occluded, what happens? There is the microcirculation plan so that the tissue should not be deprived of the oxygen. And this is the beauty of the nature, that for every system, there is a backup plan. So what happens here? BP is controlled by a variety of complex biological mechanisms which allow both short-term adaptation as well as the long-term maintenance. Short-term adaptation means suddenly the BP goes up, suddenly it is being adapted or regulated. Then we have the long-term maintenance. Long-term means when it is into the chronic phase of the disease, how it is maintained for the longer period of duration. So BP within a normal range, the blood pressure which is too high or too low can lead to wide range of pathologies. Now see, too high is also very bad and too low is also very bad for the hypoperfusion effects. So ruptured blood vessel can be there due to the high blood pressure, and reduced perfusion of the organs can be due to the low blood pressure. So blood pressure should be maintained. It should not be on the higher side. It should not be on the lower side. So therefore, the mechanism which maintain the BP homeostasis, they need to be very robust. Because see, heart is the pumping body. So when your pump is not functioning, what will happen? The whole system will be compromised. It is just like if I give you an example of a plant. If a plant, you provide soil to the plant, but you don't give regular watering to the plant, what will happen? The roots will be deprived of the nutrients, and ultimately the effect will be seen up to the leaves or up to the flowers also. So that is how your blood system, the circulatory system works. Whatever happens in the heart, in the coronary system, that will be reflected completely into the all vital organs of the body. The liver will be affected, the kidneys will be affected, the eyes will be affected, the brain will be affected, the kidneys, the lungs, everything will be affected with simple affections of the heart. So that has to be maintained into the short-term adaptations as well as the long-term maintenances. So therefore, the mechanism which maintain the BP homeostasis means the internal equilibrium, that should always be robust, should be very hard, which can face any type of fluctuations in the system. So now rapid BP regulation, how the fast regulation is being done by the system. That is the baroreceptor reflex. Who will tell me what this baroreceptor means? You can put in your chat box also. You can talk also if you are unmuted. What exactly this baroreceptor is? I just want to know what is baroreceptor. Which part of the body is involved? Yes, who will tell? Anybody?
People can mute and talk themselves if you want.
Okay.
Unmute and talk, yeah. unmute and talk, or you can put it in the chat, then I can tell that.
Okay, so that is the kidney one somebody has written, a kind of receptors in the body which respond to different kinds of pressure, then pressure receptors, then kidney. Somebody has written the nervous system. Yes, baroreceptors, nervous system is involved. How? Let's see. The baroreceptor is mean what? It is a neurally mediated reflex. Neurons are involved. The nervous system is involved. That regulates the blood pressure in the short term. Now, what happens? This reflex is crucial for the maintenance of blood pressure throughout the day, and in its absence, even a slight change in the posture can lead to significant changes in the blood pressure. This explains the postural hypertension. If you all are aware about, sometimes what happens, we see that the patient's posture also affects the blood pressure of the patient. There are mechanoreceptors, which are known as the baroreceptors, located in the aortic arch and the carotid sinus. The carotid sinus is the main thing that we discuss about baroreceptors. Now, who will tell me where is the carotid sinus? Yes, where is the, you can unmute also if you want to speak up. Carotid sinus. In the brain, in the neck, internal carotid artery, pituitary fossa, common carotid artery. Yes, anybody else? The terminology is different, but everybody is correct. So bifurcation of common carotid artery, you can see, right? So that is the carotid sinus. And many times what we do, we need to press the carotid sinus or rub the carotid sinus or give massage to the carotid sinus for many procedures in the cardiology. That is a different topic. But here the two chief baroreceptors are there. One is the aortic arch, located in the aortic arch, and second is the carotid sinus, which constantly monitor MABP, mean arterial blood pressure, and the pulse pressure regularly. Increases in the pressure, arterial pressure, results in increased baroreceptor activity. When the pressure is increased, that will go in the same direction. It will increase the baroreceptor activity, which then increases the firing rate. If you are aware that how your neurons work, they fire the stimulus, the firing rate in associated afferent neurons. Not efferent, they are the afferent ones. Carrying this information to the cardiovascular center in the medulla oblongata. So this is how the baroreceptor reflex works in the arterial pressure. I am repeating it. Increase in the arterial pressure. This direction results in increased baroreceptor activity. Both are simultaneously increasing. And then the firing rate is increased to the associated afferent neurons, which ultimately transmits this information to the highest center in the cardiovascular center in the medulla. So that leads to the maintenance of the blood pressure. In response to this, parasympathetic nervous system activity increases. Now we are getting the next step. This is the parasympathetic nervous system activity. It increases and the sympathetic nervous system activity will be decreased. This net effect will be the reduction in the heart rate, because if you know, when the sympathetic activity decreases, the heart rate will be decreased, and systemic vasodilatation collectively reduces the MABP. Right? That means when the parasympathetic nervous system activity increases, means it will lower down the blood pressure. Conversely, when the blood pressure decreases, now I am coming to the hypotension. When the blood pressure is low in the shock, when the blood pressure decreases, there is less baroreceptor activity. That means there is less impulse rate of the afferent fibers. That leads to increased sympathetic activity and decreased parasympathetic activity. The opposite to the hypertension. So here what happens? The net effect will be increased cardiac contractibility, increased heart rate, and increased systemic vasoconstriction, so that the blood pressure should increase. For the low blood pressure, we have vasoconstriction, and for the high blood pressure, we have the vasodilatation. This is how beautifully this baroreceptor reflex system works in the regulation of the blood pressure. Now, next is the, okay, there is a chart for this also, you can see. This is again the same thing that I told you. When the blood pressure increases, there is increased baroreceptor activity. Blood pressure increased baroreceptor activity. Then we have the increased number of afferent impulses. Afferent, always remember. Then we have increased parasympathetic nervous system activity and decreased activity of sympathetic nervous system. So ultimately, there will be the decreased cardiac output, low heart rate, and vasodilatation, which leads to the lowering down of the blood pressure. Now, the second is when the blood pressure is decreased in the hypotension. The decreased baroreceptor activity, decrease in number of afferent impulses toward the cardiovascular center in the medulla, increased SNS, sympathetic nervous system activity, decreased parasympathetic nervous system activity, and ultimately increased cardiac output, increased heart rate, and increased blood pressure due to the vasoconstriction. So here the blood pressure will increase. So this is how the baroreceptor reflex functions. So next we talk about the long-term BP regulation. This was the short-term BP regulation. The immediate effect. The time we took to explain this is very long time when we compare to the action of this. It works just like a fire. Immediately there is the nerve impulse, immediately there will be the vasoconstriction, vasodilatation, all the things will be just in the time period of few seconds. Next, we have the long-term BP regulation, that is to the renin-angiotensin aldosterone system, that we call it as the RAAS, R-A-A-S, renin, A for angiotensin, A for aldosterone, and S for system, RAAS. So what happens in this? This renin-angiotensin aldosterone system, it is an essential component of blood pressure regulation that acts to increase the blood volume and increase systemic vascular resistance. So now this system is dependent upon the hormonal changes which induce transcription of the genes to produce the vasoactive proteins, making it a slower mean of controlling the blood pressure because it is dependent upon the regulation through the hormonal system. So it will be a little bit slower as compared to the previous one, which was all dependent upon the nervous system. So the RAAS system starts with the renin, a hormone which is released from the granular cells in the juxtaglomerular apparatus in the kidneys, a specialized structure which involves the parts of the distal collecting tubule in the nephrons and the adjacent afferent arteriole of the glomerulus. So from the renin, this is released in response to increased concentration of the salt in the blood and reduction in the blood flow or the renal blood flow or stimulation from the sympathetic nervous system acting on the beta-1 receptors. So what happens? Renin will be secreted in response to increased salt in the blood, concentration of salt in the blood, then it leads to reduction in the renal blood flow and ultimately from stimulation from the sympathetic nervous system acting on the beta-1 receptors. Now what happens next? Then renin converts angiotensinogen. Remember there are different things, angiotensinogen, then angiotensinogen 1, angiotensin 2. And angiotensin converting enzyme. There are the 3 or 4 terms here. So renin converts angiotensinogen, which is a protein which is synthesized by liver, into angiotensinogen 1, which is subsequently converted by the ACE inhibitors. If you know the allopathic system, they give ACE inhibitors to the patients of hypertension. What it do? It exactly blocks this system. Right? So here what happens? This ACE is converted into angiotensin 2. Angiotensin 1 is converted to angiotensin 2. This angiotensin 2 causes the vasoconstriction in the systemic circulation and the renal microvasculature, preferentially constricting the efferent arteriole. So what happens to this response? ACE, which is found primarily in the lungs, also rids the body of vasodilator, that is the bradykinin, causing the further vasoconstriction. So ACE will be acting on the vasodilator bradykinin that causes the vasoconstriction. Then angiotensin 2, it functions to increase the salt reabsorption at the level of kidney through the activation of the aldosterone, which is released from the adrenal cortex, and ultimately the increased salt retention subsequently increases the plasma volume and blood pressure. This is how the blood pressure is maintained through the RAAS, renin, angiotensin, aldosterone system, right? So this was the through hormonal system. Here the hormonal system is more importantly involved. This angiotensin 2 is capable of increasing plasma volume that we have seen through the stimulation of ADH, that is the antidiuretic hormone, which increases the thirst, another regulator of blood pressure. Aldosterone acts on the principal cells found on the distal collecting tubule and collecting duct of the nephron, increasing sodium resorption that I told you, reabsorption, and simultaneously increasing the potassium secretion into the tubules. Now here what works? Sodium potassium pump. We all know how it works. Sodium goes in, potassium comes out. So here it stimulates the sodium potassium pump, so increasing the potassium secretion and sodium reabsorption. So what happens? ADH acts to increase the water reabsorption by binding to V2 receptors in the collecting duct and the DCT of the kidney. This increases the intravascular volume and then the blood pressure through an increase in the venous pressure, thereby boosting the venous return to the heart, increasing the cardiac output. So in this scenario, the time taken will be more because more complex mechanisms are involved. That's why it is for the long-term maintenance of the blood pressure. So this was about how the blood pressure is being regulated in the system of the body, the homeostasis of the blood pressure. Now we talk about the pathophysiology of the hypertension, that what happens to somebody, a patient, that there is fluctuations in the systolic and the diastolic blood pressures. So now the hypertension, it is a chronic elevation of the blood pressure that in the long term causes end organ damage. A very important thing, end organ damage. I told you in the start of this session that blood pressure is not a direct killer. It is a silent killer. It is a secondary killer because it does not come in front. It is producing certain manifestations in the vital organs of the body like the heart, the kidney. Then we talk about the liver. Then we talk about the eyes, in the brain. That increases the morbidity and the mortality in the patients. Blood pressure is the product of cardiac output and systemic vascular resistance. The patients with arterial hypertension may have an increased cardiac output and an increase in the systemic vascular resistance, or both together. So increased cardiac output, increased systemic vascular resistance, or both. In younger age group, like if we talk about the people up to 30, 35 years of age, what happens in those patients? There, the cardiac output is often elevated, while in older patients, the systemic vascular resistance is more there, which plays a dominant role. So two phenomena are there. One is the increased cardiac output that is seen in the younger age group. Then we have the systemic vascular resistance that is seen in the older age group due to the differentiation or the changes in the elasticity of the vessels in the older age group. That we talk about the peripheral artery disease, we talk about the coronary artery disease, but when we talk about the increased cardiac output, that is more towards the essential hypertension. When there is no deep pathology, but the cardiac output is increased due to the secondary factors. So vascular tone may be elevated because of the increased alpha adrenoreceptor stimulation or increased release of peptides such as angiotensin or endothelins. So that will lead to the increased vascular tone. Several growth factors, including angiotensin and endothelins, they cause increase in the vascular smooth muscle mass, termed as the vascular remodeling. Vascular remodeling, what we see after a sustained hypertension or unnoticed hypertension in any patient. Because I told you that body is designed in such a beautiful way that it has a capacity or capability to remodel itself as per the requirement of the situation. Like, let me give you an example. The left ventricular hypertrophy, what it is, why it happens? Because the patients who are having sustained blood pressure for a longer duration of time, the heart starts expanding its musculature, because it will lead to more cardiac output, more cardiac contractibility, but ultimately that will be having a compromised cardiac function. So then both an increase in the systemic vascular resistance and an increase in the vascular stiffness augment the load imposed on the left ventricle, and this induces left ventricular hypertrophy and left ventricular diastolic dysfunction. Now see, 60% of patients who come to you with a regular echocardiography checkup. Nowadays, what I am observing in my practice, that the patients who come to you, that like nowadays people are very aware about their regular checkups, and what they do, echo once every 2 years or their blood test every once 1 year. So what happens in there? Many times we notice there is simply left ventricular hypertrophy or there is the left ventricular diastolic dysfunction. Otherwise, the echo is completely normal. Now, most of the time, if I talk about the allopathic doctors, what they do, they will just ignore that. They will just ignore that. Why? Because they just believe in the game of the numbers. They want to see whether there is any gross pathological change or not, because they treat the gross things, what they can find out. But this thing is dynamic, because up to this level, there is not a disease. Left ventricular diastolic dysfunction in itself is not a disease. It is just an effect of something which is not favorable to the cardiac tissue. So what happens? Many times we just ignore this, and ultimately, and the next year the patient goes for the echocardiography, there will be cardiomyopathy, or there will be something more gross. So what we can do, we can treat this patient at this level also, just to reverse this pathophysiology, because left ventricular hypertrophy is a compensatory mechanism by the body. Just to compensate this hypertension is how the left ventricle of the heart is increased in the size, the remodeling of the structure. So if you start treatment on this point, the patient can be prevented from the upcoming gross pathologies also. Plus, you can remodel the tissue back to its normal state also. So what will happen? Left ventricular hypertrophy will be reversed. Left ventricular diastolic dysfunction will be reversed. Plus, the patient will not be having any risk for the upcoming years of the life. So then in youth, the pulse pressure generated by the left ventricle is relatively low, and the waves reflected by the peripheral vasculature occur mainly after the end of the systole, thus increasing the pressure during the early part of the diastole and improving the coronary perfusion. This is in the youth. But when you are aged, with aged people, after certain duration of aging, the stiffening of the aorta is there. The elasticity of the arteries also increases the pulse pressure. So what happens? The reflected waves, the waves travel in this wave reflected pattern. So they move from the early diastole to the late diastole in normal thing. This results in increase in left ventricular afterload and contributes to left ventricular hypertrophy. Again, the compensatory mechanism. This widening of the pulse pressure is a strong predictor of coronary artery disease. Now, who will tell me what is pulse pressure? What is pulse
systolic pressure? Systolic pressure minus diastolic pressure.
Systolic minus diastolic. So what does it mean? That the widening, the more systolic minus diastolic is, the more risk is for the coronary artery disease. So this is the part of preventive cardiology. You can predict, you can prevent. Now see, Dr. Hahnemann was giving us indications in other languages, in other terminologies for many years, almost 250 years back. But now what is happening? The science is now coming to those conclusions, right? So the widening of the pulse pressure means when the gap, the difference between systolic and diastolic is increased, the risk or the prediction of coronary artery disease also increases. So just by observing a patient, you can tell him that you are at a greater risk of coronary artery disease. Now coming to the next important part, diagnosis of hypertension. That I told you one thing, that for the 2 subsequent visits, the blood pressure should be examined. And when that patient has more than 140 systolic and more than 90 diastolic for 2 readings, that is the blood pressure patient, hypertensive patient. How you diagnose it? OPD-based diagnosis, the measurement of BP in OPD is most commonly the basis for hypertension diagnosis and the follow-up. Whenever possible, the diagnosis should not be made on a single OPD visit. 2 to 3 OPD visits at 1 to 4 week intervals, depending on the BP level, are required to confirm the diagnosis. The diagnosis might be made on a single visit if the blood pressure is more than 180 by 110. And there is evidence of cardiovascular disease. Nowadays, many patients will be there who say that I am totally fit and fine, but the blood pressure, when it is examined by your staff, examined by your nursing team, what you see, it comes out to 160 systolic, 170 systolic without any symptoms. And they are more dangerous signs. You might be reading news every day that person was in the going to the in the gym doing exercise and sudden cardiac death was there. There was cardiac arrest and patient died. What is this? These things are not overnight changes. Nobody dies overnight. Being a doctor, I can tell you, for everything which is visible can be predicted. But the thing is that either patients are not aware about it, or that even sometimes the doctors are also not responding at the right time. Now, if somebody comes to your clinic and you see that the blood pressure is 160 systolic without any symptom, that means what? That is not the first instance. This person might be having a longer journey towards this. Why? Because the body is now adapted to that 160, that it is not causing any symptomatology. So this type of category of patient is more dangerous and they need more precise treatment. And mostly either the medical science says more than 180 by 110, but I say if it comes to be more than 160 systolic nowadays without symptoms, then you can term that patient as a hypertensive. So it should be made in 2 visits at least with more than 140 systolic in the both of the visits, that we term as the hypertensive. But there is an exception when at the first instance more than 160 systolic and more than 110 diastolic on the single visit with symptoms or without symptoms, you can predict this patient is having a chronic hypertension. So that can be termed as a hypertension. Out of OPD BP measurement, now at home or with 24-hour ambulatory blood monitoring, that is ABPM. This is also one of the need of the time. Sometimes the patients say that at a particular time of the day, I have high blood pressure, otherwise I am normal. So in those patients, 24-hour ambulatory blood pressure monitoring is also being advised. So they are more closely associated with hypertension-induced organ damage and are the risk of cardiovascular events, and identify the white coat hypertension phenomenon. Now, what is white coat hypertension? Anybody? White coat hypertension.
Concentration of pressure increases.
Just by seeing the doctor.
Yeah.
Right. Many times what happens that the patient says that when I left my home, I checked my blood pressure. It was 130 by 90. Suddenly the patient enters your clinic and then you examine the patient, your staff or your team examine the patient. What happens? The blood pressure is 150 by 100. And once the patient comes to your chamber, it comes to 160, 170 by 110, 120. This is white coat hypertension. But never ignore that also. Because that is also many times what happens, we just simply ignore it in a very lighter note that by just seeing the doctor, you are having anxiety, you are having this or you are that. No. Hypertension is hypertension, whether white coat or it is other form of hypertension. You should always keep a monitoring check on that. So those patients should also be explained or identified that why is this happening at this moment. Plus, hypertension induced organ damage. The risk is very high in these patients. That I told you, the cardiac arrest, the sudden cardiac death is very prevalent in this category of the patient who are saying that I was completely fine. Just in your clinic, my blood pressure is high. So in untreated or treated subjects with OPD, BP classified as high normal BP or grade 1 hypertension. That is systolic 130 to 159 and or diastolic 85 to 99. The BP level needs to be confirmed using home or ambulatory BP monitoring. So you can advise them, you can give a chart to the patient. Nowadays, every patient has the BP monitoring, apparatus at their home, the electronic ones also. Definitely, they are not accurate ones, but still you can advise them to at least make a check on their random readings for at least 1 week, for 10 days, so that you can evaluate the patient that whether there was any fluctuation in the blood pressure during this period or not. So then the stages of the hypertension. Every disease has staging. The same way we have the stages in the hypertension also. What stages are there? Blood pressure is normal, less than 120 and 80. Then we have the essential hypertension or the elevated one, that is less than 130 systolic, less than 80, that is the diastolic. Grade 1 hypertension or the stage 1 hypertension is systolic less than 140, diastolic less than 90. Grade 2 or stage 2 hypertension, systolic 140 or higher and diastolic 90 or higher. And hypertensive crisis or malignant hypertension, what we call, when the blood pressure of systole is more than 180 and diastole is 120. This one is known as the malignant hypertension. Higher than 180 systolic, higher than 120 diastolic. And this is normal one, and this category, what we call the elevated, is essential hypertension, and the younger age group is falling in this category without any symptoms. Younger, I am talking not about 30, 35. Younger means 20 to 30 group. Because nowadays the lifestyle changes are very much prevalent and we can see the effects on the system also. So now this is the malignant hypertension or hypertensive crisis. So how many of you believe that this, because this is a crisis and emergency situation, how many of you believe we can manage it in OPD? This one, red one. Can this be managed in the OPD or we need to admit the patient into the hospital or emergency casualty? Yes? We need to admit in casualty, right, Dr. Srinivas? Who else? Anybody? Malignant hypertension, can we manage in the OPD or we need to admit the patient to the casualty? Yes? Ideally, we need to admit, okay? Right. So ideally, the patient needs to be admitted in the casualty. We can manage if there are indications for prescribing homeopathic remedy. Okay, 24-hour monitoring is required, monitor in casualty. Now see, medical science cardiovascular protocols say we need to admit the patient, no doubt in that. But many times the things are different. The patient is lying in front of you unconscious, because many times when the blood pressure touches 180, Another beautiful system by the this nervous system is there, that the body's whole system is shut down. Shut down means the patient becomes unconscious. You might have seen any patient of that patient becomes unconscious, and that is also the part of the compensatory mechanism by the body. So what happens in those cases? Suppose a patient is lying unconscious in front of you, blood pressure is 180, you don't have any symptoms at all. What will you do? Because once the patient is in your clinic, you are responsible for each and everything. Fortunately, we people are practicing in India, and we don't are that much answerable to the authorities as you people are who are practicing in the Middle East countries. We all know that, right? But still, if I talk about the conscience, if I talk about the medical ethics, if a patient is lying unconscious with malignant hypertension in front of me inside my clinic, what will be my responsibility? I cannot say them that take this patient to the hospital, because that crucial time you can waste. My responsibility lies in that at least first aid should be given to that patient, at least first aid, right? Because I will discuss one case with you also today, which was my first encounter with this type of case in 2011 or 12, I think, year 2011 or 12, when I stepped into the cardiovascular medicine with homeopathy. So malignant hypertension patients definitely do require hospitalization. There is no doubt, but many times you don't have a second option. You have to immediately act and react and to give the result. And today we will talk that how you can manage such patients also. There are certain protocols for that. So this is the hypertension staging. So now hypertension mediated organ damage, HMOD, that I told you, that blood pressure is a silent killer. It will not kill anybody with its direct impact. What happens with that? With hypertension, the other organs of the body will be having the impact, and ultimately that will lead to the hypertension mediated organ damage. The secondary manifestations which are causing the morbidities and the mortalities in the patients. So hypertension mediated organ damage is defined as the structural or functional alteration of arterial vasculature. Structural means the structure is also altered, and functional, the physiology plus pathology, now both are coming here. Alteration of arterial vasculature and the organs which is being supplied, that is caused by elevated blood pressure. So end organs include which one? One is the brain. The most important is the heart. Then we have the kidneys. Then we have the central nervous system, the peripheral arteries, and the eyes. So all these organs are the victims of hypertension mediated organ damage. While assessment of the overall cardiovascular risk is important for the management of hypertension, additional detection of HMOD is unlikely to change the management of those patients already identified as high risk. So those with established CVD, cerebrovascular disease, stroke, diabetes, chronic kidney disease, and familial hypercholesterolemia, dyslipidemia, what we call. So this collectively will be affecting your prescription also. Because I told you, preventive cardiology comes first, then comes the curative cardiology. The patient can be prevented to a certain extent. When you can predict, when you can pronounce, when you can identify the upcoming events of the damage. So hypertension, HMOD, what organs are affected and how they are affected. First comes the stroke, the brain. The stroke is there, we all know. Blood flow to the part of the brain can be blocked due to the high blood pressure, due to micro vessels rupturing. That is what we call the hemorrhagic stroke, hemorrhage of the micro vessels in the brain. So signs and symptoms can be sudden numbness or the weakness of the face, arm, and the leg. Now, who will tell me what is the easiest way to identify a stroke patient? Easiest way to identify a stroke patient. How you identify a stroke patient? Simply you are passing in your street and suddenly somebody calls you, the doctor, there is a patient who is not behaving normal. Please see what is happening to that patient. So what things you will notice in that patient which indicates that this can be stroke? Yes, anybody? Confusion? Okay. Difficulty in speech, face deviation, gait, aphasia, okay. Numbness of the limbs, asked to smile, high BP, face. So there is a mnemonic, what we call the, anybody knows the mnemonic, the 4 words we use? That is the fast. Now anybody remembers what is fast? What is for F? For A? Yes, fast. F-A-S-T. What all these 4 things are? Okay, let me tell you. F is for face. That is face drooping. A is for arm weakness. Yes, good. Speech difficulties and time. Yes. So these are the 4 things will be telling you simply that this is stroke or not. Fast. F for face drooping. A for arm weakness. S for speech. And time to call the emergency. Second is the vision loss. Now, how the vision loss occurs? Due to the hypertensive retinopathy. The retina gets the microangiopathic changes in the blood vessels. That is the vision loss. This is also one of the leading cause of vision loss, hypertension, the leading cause of vision loss in India. Then we have the kidney failure. Due to high blood pressure, it can damage the blood vessels around the kidney. Ultimately, it leads to the parenchymal changes and that leads to kidney failure. Then we have the cognitive changes or behavioral changes. The ability to think, remember, and learning may also be affected. And many times patients come to you that I have memory loss. I have difficulty to concentrate. Then we have the heart attack that I told you, myocardial infarction. It be due to the heart muscle blocked due to damage to the blood vessels. Then we have the heart failure, enlargement of heart due to increased workload from high blood pressure. Congestive heart failure that we call the shortness of breath, fatigue, edema, everything comes under the heart failure. So these are different manifestations of hypertension: stroke, vision loss due to the retinal changes, kidney failure, cognitive changes, heart attack, heart failure. Then we have the sexual dysfunction in the patients, erectile dysfunction, reduced libido is also very commonly seen in the hypertensive patients. Peripheral artery disease, the same thing which occurs in the coronary arteries due to the vascular remodeling that happens to occur in the peripheral arteries also, that we call the peripheral artery disease. The buildup of the plaques in the blood vessels due to high blood pressure, and what happens with this? It reduces the blood flow to the arms and the legs. And ultimately, there is numbness, pain, and heaviness in the feet. So these are all organs which are affected by the hypertension itself in an indirect way. And that is the leading cause of morbidity and mortality due to hypertension. So now there can be certain ECG changes also in the high blood pressure. Now anybody tell me that whether the heart rate increases in the hypertension or decreases in the hypertension? Whether we have tachycardia or bradycardia?
Tachycardia.
Tachycardia, okay. Bradycardia, okay. Definitely there are 2 only, so either it will be tachycardia or it will be bradycardia. It can be tachycardia also, it can be bradycardia also. Most importantly and most of the time it is tachycardia. That we discussed in the past slides, that you have come to know that how the pulse pressure will be telling you that whether it will be leading to tachycardia, increased cardiac output, or decreased cardiac output. So there are certain ECG changes that you should be aware about when you see a blood pressure hypertensive patient. And ECG should be done in almost all cardiac patients at a regular interval once in a year. So this is the normal sinus rhythm. You can see this rhythm. Here the blood pressure is 78, heart rate is 78. Rhythm is regular, P wave is normal, QRS is normal, PR interval is normal. So everything is normal. The rhythm is sinus, but heart rate is also normal. So this is the normal ECG, normal sinus rhythm. When it comes to the tachycardia, sinus tachycardia means there is only tachycardia, otherwise all the parameters are normal. How it will be looking? The rate is 120, you can see, and P wave is normal, QRS is normal, but here the PR interval is normal. Only the heart rate is increased. Sinus rhythm, but there is tachycardia. So then we have the sinus bradycardia, when the heart rate will be decreased. Approximately 5 to 10% of hypertension patients do have the sinus bradycardia, but 90% patients have tachycardia during the high blood pressure. Rhythm is regular, rate is less than 60, that is bradycardia, PR interval normal, QRS is normal. And if anything comes out of the box, means if the rhythm is disturbed, if it is not a sinus rhythm, then the patient needs further evaluation and investigations to find out that what is happening to this case. Because that will come to having a gross pathology in the heart. Okay, so then we come to the hypertension management part. So hypertension management, first of all, we have the lifestyle modification. The most important thing that you need to teach the patients of hypertension, the lifestyle modification. Only antihypertensives will not work. Eat a healthy diet, salt restriction is there, alcohol should be limited, caffeine shots should be limited, smoking should be completely stopped, exercise should be regular. So these small changes in the lifestyle can help the patients to reduce their blood pressure without medicines also. So always remember, when it is essential hypertension and at a very younger age, you should not prescribe medicine until and unless we feel that without medicine, that patient is not getting benefits. So minimum medication and high restrictions in the diet and lifestyle changes can help the patient to get the better changes. So this is simply the lifestyle modifications and the diet modifications. Now I'm shifting to the most important part for the day is the pharmacodynamic treatment of the hypertension. What medicines on the basis of pathology, on the basis of pathophysiology, on the basis of the dynamicity of the disease, we can prescribe for the hypertension exclusively. So now cardiology medicine, although deals with the heart and its system. Now this is how the homeopathic system is totally different from the conventional system you see. But it always includes the whole body or the systems of the human body, as every corner of the heart demands and needs the blood. And so the treatment should not be restricted to the heart only. But in allopathic system, what is happening? They are prescribing beta blockers, calcium channel blockers, ACE inhibitors, statins, just a symptomatic treatment. But here we don't do the symptomatic, we take the whole system as there and prescribe the medicine on that basis. So the treatment should not be restricted to the heart only if we do so, except in the emergency crisis, because in emergency crisis, Dr. Hahnemann himself has directed us to use the palliative care, because when the vital force is in suspension, you need to act very fast, otherwise it will not survive. So here we are somewhere ignoring the basics, principles of system, and without following the principles of homeopathy, we can never attain the level of success in any stream of homeopathy. Whatever way you prescribe, I am not saying that use only mind, use only physical journals, use only mental journals, don't follow anything blindly. Select your medicine on any basis of the symptomatology, but it should be within the sphere of the principles of the system. Keeping in mind the equilibrium that heart provides to the human body, we should take the steps ahead while prescribing. So first remedy comes to my mind is the adrenalinum. Adrenalinum, name itself tells you that it is being prepared from the adrenaline, what we call. So this medicine is prepared from adrenaline or epinephrine, the active principles of the medulla of suprarenal gland. Now see, now what this medicine will be helping to do. We studied the RAAS system and we studied the baroreceptor reflex. This medicine will be targeting that. Is employed as a chemical messenger in the regulation of activities of the body. In fact, its presence is essential to the activity of the sympathetic nerve, the sympathetic nervous system. So here, it is doing its main action, the stimulation of the sympathetic end of the nervous system, notably the splanchnic area, causing the constriction of peripheral arterioles. So here, with resulting rise in blood pressure. So when you prescribe it into the potentized form, it will be helping for the vasodilation. Getting my point? The things which are present in the proving, which are present in the crude form of the medicine, they are being helpful, cured by the medicine in the dynamic form. This is what principle we work on. So hence it is used as a first line drug in the cases of hemorrhages also and the hypertension also. And let me tell you, this medicine is the one of the best medicine for essential hypertension plus for the hypertension which is asymptomatic. The beauty of this remedy is that when applied locally on the sites of hemorrhages, it causes the vasoconstriction of the blood vessels. Hence a valuable, strong, astringent and hemostatic in crude form, and invaluable in checking the capillary hemorrhages from all the parts where the local or direct application is feasible. And on the other hand, in the dynamic low potencies, in 6C, 12C, 30C, when it is given, it reverses the vasoconstriction and helps as a strong anti-hypertensive drug. So adrenalinum generally we use in 3C, 6C, 12C and 30C dilution. Clinically proved in the cases of essential hypertension, I told you, where no etiological factors or deep underlying pathologies are found, used in the lowest dilutions. Most of the cases of hypertension asking for the adrenalinum are those which are either accidentally diagnosed during the routine checkup or without any symptoms of the hypertension. Frequently used medicine in cardiovascular emergencies when there is slowing of the pulse, because this leads to the vagus stimulation and strengthening of the heartbeat, increased myocardial contractibility, resembling the digitalis where it has increased glandular activity, glycosuria with depression of the respiratory center. So this is the part when it is being used in the emergency crisis, but otherwise for the essential hypertension, for the asymptomatic young patients, accidentally diagnosed hypertension patient, we can use into the low dilution. Next medicine comes is the aurum metallicum, aurum met. This is the gold for the heart also. Disturbed circulation is there. All the blood vessels seem to having the blood rushing from head to the lower limbs. Opposite to the glonine. In the glonine, what we see, the blood rushes from the central part of the body to the head, but here it rushes from the head to the lower limbs. Orgasms of the blood as if boiling in the vein, erratic ebullitions with sharp shooting of the blood pressure, venous congestion, go to the head and chest, the pains start wandering, impelling motion, finally they attack the heart. Extremely violent symptoms and chronicity of the complaints, heart feels loose on walking. There is sinking down sensation in the patient when it feels like my heart is sinking down. Cardiac ailments after the effect or the ill effects of grief, fright, anger, disappointed love, contradiction, reserved displeasure, prolonged anxiety, unusual responsibility, and loss of property. And let me tell you, this is the best medicine for those patients who have the business failure and ailments after that. Business loss. Aurum metallicum. Heart seems as if stopped beating for 2 or 3 seconds. And this remedy is one of the best remedy for the skipped heartbeats. Immediately followed by one heart thump and sinking at the pit, violent orgasm as if the blood were boiling, jumping sensation of the heart is there, palpitation so hard that drives from place to place, pulse is rapid, feeble, irregular, the carotids and temporal arteries throb visibly. Visible throbbing of the carotid and the temporal artery. You can see in these patients. Palpitation compels him to stop. And another important pathological finding is there when there is high blood pressure in the cases of valvular lesions in arteriosclerotic nature, the valvular heart disease. Aortic stenosis is the most common disease what we notice, hypertension in aortic stenosis. So that can be visibly seen in the cases of valvular lesions of arteriosclerotic nature, aurum metallicum. Then we have the next remedy, that is the conium maculatum. Conium maculatum, this is the poison that we all know. With this poison, Socrates, he was being killed in the history. This is the same poison used to kill Socrates from the pages of the history, and it causes the paralysis of the respiratory muscle. Now see, if you want to study any remedy, just connect it with any historical event or it connect with any of its botanical or zoological or chemical properties. Now this poison killed Socrates. So you can just simply examine that how he was killed. What happened when he was being given this poison? It caused the paralysis of the respiratory muscles, ending up with severe headache, dryness of the mucous surfaces, nausea, and finally there was respiratory failure. So now the patients who call for the conium maculatum, they have complaints associated with the head and the extremities. It has a sensation of scorched feeling on the top with tightness as if both the temples were compressed together from each other. So conium maculatum, a very severe constriction in the temples will be noticed. The bursting headache with hypertension is noticed. When shaking head, feels the pain from brow to the occipit, from the eyelids to the back of the occipit, as if something had been detached, as if brain had gone to sleep, and tearing in the temples, in the sides of the body, aggravation to touch, motion, stooping, recumbent position after eating. These are the aggravating factors. Oversensitivity to light during high blood pressure. You can simply flash a torch in the eyes of the patient, and that will tell you that whether it is a modality or not. Heavy and weary, paralyzed, trembling, hands are unsteady, fingers and toes are numb, muscular weakness is there, especially of the lower extremities. Then another interesting finding in the cases of hypertension is buzzing noises in the ear on lying down. Many times the patient comes and tells that when I sleep down, I do feel buzzing sounds in my ear. That is a typical indication of conium maculatum. And many times, many patients do have this as a side effect of the atenolol also. The most commonest use allopathic, this beta blocker for the hypertension patients, atenolol. That also causes, when prolonged use is there, it also causes the buzzing sound in the ear. So that can also be recovered with the conium maculatum. Then comes Veratrum album, a beautiful remedy which has a good seat of action on the hypertension. So it is most indicated drug in the cases of essential hypertension to malignant hypertension with the emergency knock also. A clear picture of collapse with extreme coldness, weakness is being offered by this drug in the hypertension. Irregular pulse is there, palpitation with fast respiration, which is marked in emergency cases. Now mark this remedy. This was the first drug that I used in my first emergency of my practice in 2011 or 12 that I told you. Veratrum album. I will share that case in the upcoming slides also. So Veratrum album was being used with typical this picture. The patient collapsed with high blood pressure, extreme coldness was there, weakness definitely there, palpitation with fast respiration and irregular pulse. So this can be enough indication for you to prescribe Veratrum album in the cases of emergency crisis also. Cold perspiration on the forehead, and most important symptom in this patient is on the vertex, on the top of the head, there will be a typical headache with sensation of vomiting. Vertex headache with vomiting sensation during hypertension, always remember of retrum album. That is a marked feature. The attacks of symptoms are violent and sudden, with action of remedy is quick than any other remedy. Clinically proven as the best remedy in the cases of hypertension, excessive dryness of all mucous membranes, with increased thirst for the cold water with raised blood pressure. Veratrum album is the remedy. Sensation as if ice on the vertex with violent pain, plus accompanied by a vomiting sensation. Then desire to vomit, I told you, sensation as if he feels that the head would burst from the top. Marked photophobia with desire to close the eyes, that will be ameliorating factor. If the patient closes the eye, that will be giving relief to the patient. Palpitation and anxiety with rapid audible respiration, pulse is irregular, feeble, slow, and thready. Now, what things we see in the pulse? That what is the character, the rhythm, what we call, whether it is bounding pulse or it is feeble pulse. Is there any accompanied pattern that is a thready, just like a thread? So veratrum album gives irregular pulse, feeble, plus slow and thready. A very good drug for the chest pain after uncontrolled hypertension with cold sweating and collapse. Chest pain with cold sweating and collapse. If some patient comes to you with cold sweating, headache was preceded with vomiting sensation was there, or even if the patient vomits also, not only sensation, but the vomiting was there. Along with that, patient collapses. And after that, patient recovers and revives, and there is the chest pain. That can be an indication also. So better than arnica in that situation. So then we have another drug, that is the Coffea cruda. Coffea cruda, wonderful drug which acts directly on the nervous system. Marked action of stimulation of the functional activities of all the organs, increasing the nervous and the vascular activity. Great nervous agitation and restlessness with extreme sensitiveness characterizes this remedy. It is well known for the unusual activity of mind and body, bad effects of non-expressed emotions, surprises, and the joys. Now, you might have seen, very rarely it happens that somebody died of happiness. Many times there are cardiac arrest when the patient is very happy. And I have given a reference of this movie. Anybody has seen this? Malamal weekly movie was there. That was a comedy Bollywood movie. Anybody has seen this movie? If you remember, there was a character, Anthony. Just imagine that character, what happened? His ticket was being selected for a huge amount in the lottery. And that person could not express the happiness, could not tolerate that happiness. And what happened? He died over the chair sitting in, that was shown in the movie. So in our Materia Medica also, there is a rubric. Ailment from over-expressed happiness. Not only the grief is always the killer. Sometimes people die of over-happiness also. So only remedy is the Coffea cruda in the Materia Medica. So Coffea cruda, when there is non-expressed emotions, surprises, and joy. Coffea increases the sensitivity of the nerves, making them overexcitable, oversensitive. The senses become over-acute also. That's why we use this remedy for the insomnia, for the sleeping disturbances. Pain, touch, noise, odor become intolerable, particularly also an increased perception of the slight passive motions. The cases of hypertension will be present with the violent irregular palpitation after excessive joy or surprise, nervous palpitation and trembling of the limbs, sudden rise of blood pressure, pulse is full and frequent, more frequent but less vigorous and even small and weak. Will be frequent, rate will be high, but it will be less vigorous. It will be weak, not bounding pulse. Cardiac complaints accompanied with the urinary suppression or the disturbance is caused. Headache is characterized by tight pain, worse from the noise, smell, seems as if the brain were torn to the pieces or the nail driven into the head. Constant inclination to vomit during increased blood pressure. But remember, Veratrum album can vomit also, but Coffea cruda will not be able to vomit. It has the inclination or the tendency to vomit. Then we have the Gloninum, a wonderful remedy, where we have the explosion, because it is a nitroglycerin. It is prepared from the nitroglycerin. There is an explosive substance, so ultimately the action is also quick. The pathology is also quick. It is violent, bursting with expansion. A tempestuous remedy act upon the circulation when it causes the violent pulsations, ebullitions, and congestions. Most common indication is sudden rise of blood pressure. You are practicing in Middle East, and in your country, due to the temperature, I can expect that this medicine will be the most commonly used into the peak summer period. Violent palpitation, throbbing carotids, full tense pulse, fluttering, palpitation, dyspnea, heat in the face, should be remembered in the cases of increased blood pressure of the aged people. Pulse is accelerated, rises and falls alternatively. Heart action is easily excited with violent palpitation. Gloninum, when there is a rushing of the blood towards the head, towards the face. Great remedy for congestive headaches, hyperemia of the brain from excess of heat or cold, confusion with dizziness also, throbbing headache, neuralgia, that is angiospastic neuralgia of the head and the face, cerebral congestion. Then we have the fluttering palpitation with dyspnea. Any exertion brings on the rush of the blood to the heart, and the fainting spells are there, throbbing in the whole body to the fingertips. So this is how the Gloninum works. Then Veratrum virid. Veratrum album we have discussed. Another remedy is Veratrum virid, and I can tell you that this remedy is the best remedy that we can term as the atenolol of homeopathy, because this is the one of the best beta blockers. And those patients who are on a prolonged intake of the allopathic antihypertensives, if you want to taper that down, you can prescribe this remedy side by side, and easily the tapering of the allopathic medicines can be done. Auricular fibrillation induces fall of the both systolic and the diastolic blood pressure, and the silent hypertension also. Then we have the atenolol that I told you, pulsations in the body, especially in the right thigh, rapid pulse with low tension. Pulse is rapid, but the volume of the pulse is low. Valvular heart diseases. Then we have another remedy, that is the Sumbulus moscatus. This remedy will work in those cases when we have the gross pathology. So Sumbulus moscatus for the affinity in cases of hypertension where the patient presents with an underlying pathology of the heart. There is gross pathology, there are the visible changes, and also known as a tissue remedy in cases of arteriosclerosis. If you study the literature, you will see that many stalwarts in the homeopathy, they were using this remedy, Sumbulus moscatus, for valvular heart disease, coronary artery disease. Sensation in the heart as if beating in the water, sinking of the heart, sickliness and the faintness all over the heart. Pulse is irregular with high blood pressure due to the arteriosclerosis. Gross pathological changes, arteriosclerosis. Impulse is strong, jerking pulse, beating rapidly 8 or 10 times, then there is a slow pulse. This is the pattern. Like in Aurum Metallicum, I told you, skip beat after every second or third beat. So these are the clinical findings that you can correlate with your patient during the examination. Bellow sounds of the heart, violent irregular palpitations, and flushes of the heat in the front from the back. Now see, what are the bellow sounds? Very severe murmurs that you see in certain cases of congenital heart disease. Very loud murmur, bellow sounds. Nervous heart affections, wiry shooting in the fingers, stooping with numbness, that is aggravating factor, one of the best clinical findings. Now see, remember, this will be a distinctive or pathognomic sign or symptom for this remedy. One of the best clinical finding that makes sure prescribing of Sumbulus moscatus is the auscultation of an indexed mixed murmur and purring sound that is not heard anteriorly. At the apex of the heart, you will not be able to hear it on the anterior part. Auscultation, and that is commonly seen in the cases of coronary heart disease in the heart blockage patients. The bellow sounds, the indistinct mixed murmur sound. Sumbulus moscatus. Another remedy is Revolvia serpentina, and Revolvia, I will say, this is the most misused remedy that we have in homeopathy for hypertension. Why misused? Because every person who does not know detailed prescription about hypertension, these remedies that I told you, they simply prescribe Revolvia mother tincture to all patients. But Revolvia is much more important and much more deep acting remedy. This represents its sphere of action in the condition where it has a general and cerebral hypotonia, lack of tone in the nerves and circulatory system causing most of the complaints. Most abused remedy for hypertension, because for many cases it is being prescribed without indications also. Although it is one of the best medicines in the cases of essential hypertension, but it still needs to have the similar symptoms like other medicines to be prescribed. It tranquilizes the mind, promotes the sleep, and lowers down the blood pressure. Now, what are the active principles of the Revolvia? Respirin is the active principle. It is an alkaloid. It is responsible for its blood pressure lowering activity. The alkaloids cause depletion of norepinephrine, resulting in a tranquilizing effect. Blood pressure increases are often a result of the plaque in the vessels, reduced kidney function, concomitant retention of the fluids, because Revolvia is a good diuretic also. Not only antihypertensive, but it is a good diuretic also. So hypertension with congestive vascular conditions can be given this remedy. Palpitations, prickling, irregular heartbeat, vertigo, precordial heaviness, cramping pains which are spreading toward the neck, discomforts, tendency to the faintness with sticky sweating from the hands and the feet. So all these are the indications for Revolvia. So these were few remedies that I am sharing with you. I don't say that this is all hypertensive drugs, but these are the chief drugs which I use in my practice for approximately 80 to 90% of the cases, depending upon the symptom similarity. Now, emergency crisis protocol. I asked you that if a patient comes to you with malignant hypertension, what will you do? Everybody told that we will be requiring a hospitalization for this patient. But sometimes you need to give something as a first aid to the patient. Then what will you do? Without any sign, without any symptom, what can be done? Let me tell you a 13 years back experience. 2011 was the year, or 10 was the year when it was initial years of my practice as a general physician. I was just about to leave my clinic for my lunch at around 2:30 or 2 in the afternoon. There was an anxious noise from the reception area. What happened actually? There was a lady in her 30s age. There was one episode of vomiting in my reception and she collapsed there just while entering my clinic. And you can imagine that early years of your practice, just 1 year was there when I started practicing, and that patient immediately collapsed in front of you and you don't know what happened to that patient. What will be your response? She was accompanied by her husband who worked in a bank with her. I had no idea exactly, nothing was there, what happened to her. But yes, her husband, he was so much in trauma that he could not even tell that what happened to her. He was also very anxious. So just at that moment, what will you do? You cannot wait for an ambulance to come and take that patient to the nearby hospital. Your conscience will not allow you. Your ethics will not allow you. Being a doctor, this is your duty. You should do something for her. So what happened? We made her lie down on the sofa on the reception and just checked her pulse in haste. And I was worried what can be done in my case, in this case, because I was not having direct experience of handling any such case. So what I did, By pulse examination, it was 92 beats per minute, and the blood pressure was 180 systolic and 110 plus diastolic. So that means that was the malignant crisis, the hypertensive crisis, what we call. No symptoms are there. What to do? You need something to prescribe to lower down the blood pressure, to get her conscious back, at least something to be done. So I luckily had an exposure in hands of certain allopaths during my clinicals in my undergraduation. So I started evaluating my mind, what can be done to this patient, because that was clear. She collapsed due to hypertension crisis. Now, whether it was stroke, one thing, whether it was just the shutdown of the system by the body, whatever it was, but my attempt should be to revive the patient, whatever I best can do for that. So my mind clicked with the Viratram album. 0/1 was given. Why Viratram album? Because vomiting was there, that I had read in my materia medical learning, that if there is vomiting with collapse, with high blood pressure, you can think of the Viratram album. So I had LM potency at that time. Prescribed 0/1 dose, frequent doses were given to the patient within gap of 5 to 10 minutes. Within first 2 repetitions, just 2 minutes was passed. The patient regained her conscious, but the BP was still at that moment. Now, she could explain her condition, but the BP started sliding down, rolling down, and that came to 140/96 within 20 to 25 minutes. And the patient, after having 2 glasses of water, was sleeping comfortably in her husband's lap. So now this all incident took approximate 30-35 minutes. And in my country, if I call an ambulance, I can tell you that it will take minimum 15 to 30 minutes to come. So by the time, what will you do? So your mind should be prepared for such scenarios also. When the patient is inside your clinic setup, when the patient is in your hands, under your observation, you should do something for the patient. And that comes when you have that quick mind, clinical tips. Plus, if you are aware about these type of remedies we have and this type of symptomatology, evaluation can be done in crisis, then you can prescribe without any haste, without any fear also. So this patient was completely okay within 45 minutes. She went home. Another thing, if she would have gone to a hospital, you can imagine what would have happened to this patient. She might be there for at least 2 to 3 days. First day would have been in ICU. They would have done the angiography of the patient. MRI of the brain would have been done. So in Indian currency, if I evaluate, approximately 1 lakh rupees bill was ready for this patient. Plus the harassment, plus the trauma of hospitalization, that has no cost at all. So OPD facilities can also help the patients, can also help. So this emergency show of around 40 to 45 minutes changed my perspective towards my own profession, my own system, my own practice. And it was a time when I started my journey towards the emergency medicine, to the critical care medicine, particularly toward the cardiology. And that became passion, destiny, my soul. And now we are dealing each and every type of cardiac patient without any second thought. The same remedies we all have in our materia medica. I'm not using something different, but we are dealing with the hypertension, we are dealing with hypotension, valvular heart disease, congenital heart disease, coronary artery disease, peripheral artery disease. Everything can be managed without a second thought. I am not saying that every patient can be cured. There are certain limitations. That is a different perspective, but how you approach, what you can do, at least something can be done better than the conventional system. This is what I want to tell you all. So malignant hypertension protocol for emergency, Aconite Q. Now many will say that this is the poison. How can you give poison? But yes, poison is also one of the best medicine if being given in a very controlled manner. Aconite Q, 5 drops, stat dose plus ferritum album 200. The first line of treatment, if you don't know anything about the case. Second, line of treatment, if this does not work, and always remember in emergency medicine, just give 10 minutes to your prescription, not more than that. If within 10 minutes, the patient is not responding, immediately change your prescription. You don't have that much ample time in your emergency crisis. Adrenalinum 3x or conium maculatum 200 can be thought of in the second line of treatment. Terminalia Q, 10 drops stat can be given if you don't get result with the second line. And amyl nitrosum Q inhalation. Just by inhaling the mother tincture of amyl nitrosum, that is the rescue, and that I will say is the last resort in such cases. But the challenge with amyl nitrosum is that it is a very short acting remedy for 5 minutes, for 10 minutes, or up to 15 minutes. But yes, for the crisis purpose, it is a good remedy. The patient can come out of the crisis and then you can think of some other medicines. Amyl nitrosum Q inhalation can be done as a rescue remedy if the first line, second line, and third line of treatment does not work. Yeah, with nebulization, we can also give, no issues with that, but nebulization sometimes is not available in all the clinical setups. So inhalation is the best because amyl nitrosum is such a volatile mother tincture. If you open up the bottle, within 5 to 10 seconds, the whole of the room will be having the smell of amyl nitrosum. So nebulization is a fast way you can give, but I have seen that it works only with the inhalation also. So this is one of the course that we are conducting. Somebody messaged me last evening. So this is particularly for the cardiology only. Cardio home that we call in the cardiology, complete how you manage such patients, what are the different disorders. So everything in a detailed 6-month complete study through the virtual sessions. So that was all for today's session. Thank you again. Thank you so much for inviting me for this wonderful session, and everybody who listened very patiently, very carefully. Thank you for giving this precious moment. Any doubts you can put in within the next 5 to 10 minutes. Thank you so much.
We can move on to the question and answer session. So if anyone have a doubt, you can put it in the chat box and we can take the question and answers.
So maybe you can stop screen sharing. We can have you on the panel then.
So the question is there, in which potency veratrum virid to be used to taper? Yes, veratrum virid generally we start using in 30C and then you can increase up to 200. And within 45 to 60 days, you can start tapering down the allopathic medicine depending upon the severity of the disease, plus how many antihypertensives are being prescribed to the patient. So veratrum virid is the 30 to 200 is the best choice of remedy. Is any other doubt?
Okay, I have one question. Can you share your experience with hypotension? Hypotension,
yes. Now, let me tell you that in allopathic system, they don't have any oral drug for hypotension, for low blood pressure, right? But in our system, we have ample number of drugs. We have gelsemium, we have Verita-Mur, we have Verita-Carb, then we have Cactus, then we have Digitalis. So all these remedies can be think of in the cases of hypotension depending upon the underlying pathology. Viscum album. Viscum album is also good remedy. But see, Viscum album actually I don't use in hypertension because Viscum album is made for much more higher purposes because it is a good remedy for hypertensive nephropathy. Viscum album, a wonderful remedy for the cases of chronic kidney disease. So you can give in the hypotension cases also. Anyone having any other doubt?
Which potency of use for Rolfia?
Rolfia generally is being used in mother tincture.
Okay.
But I don't recommend using Rolfia for hypertension because I told you that this is the most malpracticed or misused remedy for hypertension in homeopathy, because Revolfia is also one of the remedy which has much more better higher purposes. Like if I talk about the cancer, Revolfia is the one of the remedy which we prescribe for the patients of malignant pleural effusion. In the cases of CA lung, CA breast, if the patient has pleural effusion with the malignant exudates, this remedy is wonderful remedy for that case. So always try to differentiate that what purpose which remedy can serve in your clinic. If you start giving life-saving drugs to your acute patients, so that will not make the practice. Differentiate your practice, that what are your day-to-day using remedies, what are the remedies which can be life-saving drugs also. Like Aconite Q, I told you, Aconite Q we don't give to a routine patient. That is just like a very large weapon, because if there is a, you can say, assault, two countries are fighting at the border. So what they do, they don't start putting the missiles first. Step by step things are being done. So in that case also in your practice, you should increase your medicine expansion step by step as per the need of the case.
Okay. Thank you, sir.
Yeah. Which diuretic
Sir,
we use?
Sir, Revolfia can be given in Q in that malignant pleural effusion case or in potencies, sir?
In Q also, yes, in Q, because Revolfia is not that much well-proven remedy in the dynamic potencies. So we prescribe generally in Q only.
And one more, sir, Viretram album you have given in 0/1 in the emergency case. If at all we have the 200 potency, that also we can try, sir.
Yes,
200 potency.
In routine patients, we use in 200, but Viretram album 0/1 was given in emergency because in that case, we need frequent repetition at an interval of 5 minutes.
Yes, generally millismell we don't have at clinic all the time. And the other, one more doubt, sir. So 2 weeks back, I got that malignant hypertension patient with 180 and 110. She is a 35 years old lady, but she doesn't have any complaints, and not even, she doesn't know that it is she have hypertension also. So I made her to come 3 successive days in the same time. So and then I have checked the BP, that was the same. And she just came for her obesity. She has obesity, and her mother also has the same hypertension, and she is happily living 72 years age. So what can we do in that case? Should we alarm them with the hypertension, or should we give away the symptoms?
No. In that case, if the patient is asymptomatic plus keeping in view her age, so you need to see that what is the underlying cause. For that purpose, first of all, echocardiography is mandatory in that patient.
Sir, all her test levels are completely normal, sir. I made her to do the routine master health checkup, and in that 2D echo, stress test, everything is done. And she is completely normal. She doesn't even have cholesterol also, higher cholesterol levels also.
And echo was also normal?
Echo was completely normal, sir. EF% is also 72.
Right.
And
in that case, it can be a case of that I told you, that when the age is at above 60, it can lead to the vascular resistance.
Okay.
Right. So in that scenario, we treat it as a case of arteriosclerosis.
Oh, okay.
Peripheral.
No, the patient is 35 years age, sir. But
35.
35. My patient is 35 years, and she just came for the obesity reasons. And her mother is also in the mother is also same situation, and she doesn't have any complaint.
Right. So patient was 35. I heard it is 65.
Yeah, 65 is mother, sir.
When it is 35, so we know that it is a case of hypertension that I told you in the younger age group, where you don't have the pathological changes, but you have the functional changes.
Okay.
Right. So in that cases, conium maculatum can be the best choice of remedy.
Okay, sir.
Conium maculatum in 200C dilution will be the best remedy.
A few more questions.
I'll try that one. Thank you, sir.
There's one question Dr. Alim had asked. There is a 90% block and angiography with mild symptoms of dyspnea on exertion. That's what I think, what he has written. Yeah. So what is recommended, he had asked.
See, 90% of block in angiography, in which coronary artery, that is more important. Whether it is the right main coronary artery, whether it is the left main, whether it is the branches like LAD or LCX. So if you are aware that which artery is involved, I can answer in a better situation.
Doctor Alam, if you want, you can unmute and talk yourself, doctor.
Hi, sir. Good afternoon. This is very much interesting session and great learning. Thank you very much. Many times we are getting this type of situation. You know, patient is already under treatment for some other purpose, and they come across the situation where they are undergoing an angiography and block has been detected, but patient is asymptomatic. So depending upon artery, also remedies are selected.
No. See, when we have a clinically evident case of arteriosclerosis, we have 90% of blockage.
Yes.
So what we need to do, we need to do one thing. One is to prevent the further blockage. Plus, we need to prescribe some remedies which can dissolve that remedy, that anti-atherogenic remedies. Anti-atherogenic remedies, which medicine we have? We have Terminalia arjuna, we have Crataegus, we have Strophanthus ispidus, we have Berita mur, we have Calcarea carp, we have Cilicia, right? So always see what you are able to find out in the patient. Pathology and physiology are always important along with the symptomatology. Aphorism 3 of Organon of Medicine is what? First, we need to diagnose the disease. Then we need to diagnose the remedy. Then we apply the knowledge of diagnosis of the remedy to the diagnosis of the disease. This is what you do in your practice. But unfortunately, the practice we people are doing, the study we people are having in our medical colleges, we are being taught that homeopaths don't need diagnosis. We treat as a whole. But in that whole, we do conclude the diagnosis of the pathology also.
True.
Right? Prescription can be any way. Either you catch your ear from this side or from this side or from this side. The target is your ear to be caught.
My question was that are there any specific remedies indicated for a situation, or we go by the constitutional approach?
Constitutional approach will come when you are having a patient whose blockage is less than 40%.
Yeah, that's what I'm saying now. So here in case I'm talking about a scenario where the blockage is 90%. So what specific remedies do you recommend?
Yes, I told you anti-atherogenic remedies, the Berita carb is there, Terminalia arjuna, Crataegus, then Adonis, if the walls are involved, can also be thought of. Berita mur can be thought, Calcarea carp can be thought. Constitutional medicine will be helpful in those cases when you want to prevent further damage.
So we'll go on to the next question, sir.
Sir, I have
Dr. Jamshina had asked, what is the potency for Oramet, Coffea cruda, Glonine, and Veratra malco?
All medicines 30 or 200 C dilution.
Okay. The next question is Dr. Srilekha had written, what is the management in white coat hypertension?
Management, white coat hypertension, generally we manage as an essential hypertension. The same way like adrenalinum I told you is a wonderful remedy, because white coat hypertension you might be noticing mostly in the middle age group. Right? So
I have a question, sir. This when you're talking about adrenaline 3x and 6x, how long do you repeat them, sir?
No, 3x, not I told you 3x, 3C.
3C, okay.
Yeah. So generally 2 times a day or 3 times a day in liquid potencies. Liquid potency means like 30 ml of distilled water you take, you add 2 to 3 drops of alcohol, you add 2 to 3 drops of medicine, then you give 10 succussion, and from that preparation you give 10 drops to the patient 3 times a day.
For how long they can take, sir?
For how?
You can. This can be repeated for few months, or how is it?
Yes, it can be repeated because the dose is very minimal. If you say only 3 drops of the medicine, you are giving in a 30 ml of dilution.
Okay.
Yeah.
So there is the next question. I request everyone to unmute your mic. Whatever question I will handle it, please type it on the chat box. Otherwise, everyone unmute and speak. It will be difficult. We'll address all the questions so that you can put it on the chat. Next question, Dr. Kavita had asked, which diuretic we use with hypertensive drugs in case of retention of urine?
In retention of fluid, if we want to add a diuretic, because most of the medicines which are antihypertensives in homeopathy, they are diuretics also. Like we have Crataegus, that is diuretic. We have this Terminalia, that is also diuretic. We have Apocynon. In some cases, when the abdominal, this liver is involved in the cases of hypertension, we give Apocynon. Otherwise, you can think of Digitalis. So depending upon the need of the case. Like hypertensive nephropathy is there, then you think of Vesicarium mother tincture. So depending upon the need of the case, which system is involved, you prescribe the diuretic.
Next question is by Dr. Nivya. She had asked, can you say something about Crataegus?
Crataegus is the remedy that we use in some cases when you have the gross pathology in the coronary arteries, because it is the anti-atherogenic drug, which has the properties for the dissolution of the plaques. So it is an anti-hypertensive drug also, plus it is a good choice of remedy for the heart blockage patients.
Dr. Anu had asked about Spartium scoparium. Can you say something about it?
Spartium scoparium. No, I have not used this remedy till now. Yeah.
And Dr. Ritu had asked, what would you recommend in congenital abnormalities leading to hypertension?
Congenital abnormalities, hypertension. If it is the systemic hypertension, then you treat it just like a hypertension patient, systemic hypertension. But if it is a case of pulmonary hypertension due to the congenital abnormalities, like we see in the cases of congenital heart disease, then you need to prescribe a wonderful remedy, that is the laurocirrhosis.
Can I just intervene? So there was a case of coarctation of aorta for a 3-month-old baby, which I think most of the doctors here, they know, because this was, the father was approaching a lot of homeopathia because he had a lot of faith in homeopathy. Okay. So everybody said no, because we thought it was not hypertension, but he was advised surgery. And it's a second surgery. The first one was not successful. So it was a surgery that had to be done. Do you think we could have helped in that case in any ways?
Coarctation of aorta, if I talk about as a disease, we cannot do because it is a surgical intervention required in that case, right? But if I talk about the post complications or symptomatic management, we can manage it as the symptomatic disease only.
Symptomatic. So in case we refer that patient to you, you'll be able to manage that patient? I mean,
yes, definitely. Definitely, whatever best we can do, but coarctation of aorta itself is unmanageable with the medicines.
With the
medicine. Requires surgery, yeah, because that is emergency crisis.
Post-surgery, it can be referred.
Post-surgery, definitely. And chances of reoccurrence are there sometimes in those cases due to some genetic involvement. So that can also be prevented.
Okay, thank you.
Yeah.
Next question we are moving. Dr. Nida, she had asked, how do you manage and determine effect of homeopathic medicine in chronic cases of hypertension who are on antihypertensive?
Okay, so manage the...
Probably while you start parallelly or something, then how do you know that?
Yeah, when you are, see, hypertension patients come to a homeopath due to two reasons. Either one is they are not interested anymore to take allopathic medicines, and they want to shift to the homeopathy. Second reason can be, despite taking 5 to 7 tablets every day, they are not able to still control their blood pressure. In the first case, you have a certain protocols that we will discuss some other day, that how you taper down the medicines, at what type of substitute is required. Second case is when the patient is not getting benefit with the allopathy and you want to shift to the homeopathy. Let the patient take allopathic medicines for 3 to 4 weeks. Simultaneously, you start your medicine side by side. Once the blood pressure starts under control, slow by slow, you start tapering down the allopathic medicines. And within 6 to 8 weeks or maximum 10 weeks, around 90% of patients can be shifted to homeopathy.
Next question, how to manage case of alcohol-induced hypertension?
Alcohol-induced hypertension is always the short-acting one. If there is no gross pathological changes, more over the time what happens, in the morning, sometimes the patient checks the blood pressure, it is at the very high peak. then it comes down gradually without any treatment also. So here, the constitutional treatment will be more beneficial in this scenario.
The next question is how to buy your book, sir?
Book actually now we are out of stock for last 2 to 3 months. But as soon as we get the next edition that is in the press, we will inform you.
I think the next one is a personal question. I think you can write. We will share the email ID and contact number of doctor, and you can reach to him. There was another case someone had returned, so we don't want to take up that now. Okay. Someone had returned smoking-induced hypertension.
Smoking-induced hypertension, the best remedy is the tobacco. Tobacco, for any ill effects of tobacco or smoking, you can think of tobacco.
I think that's it, sir. We have done with all the question and answers.
Right. So email ID and phone number I have mentioned in the group. If anybody wants to talk anything about the personal issues, they can contact me. No issues, right?
Yeah.
Okay. So I think we can wind up now.
Yes, sir. I mean, I'll just do. It's been a wonderful session, Dr. Bindra, and we are extremely grateful for you for having this excellent webinar for us and detailed class on hypertension, covering the pathophysiology, how to diagnose, how to assess the complication of hypertension, and very, very useful in clinical information, how to go about with the management and the protocol in emergency cases. Been really, really wonderful. And thank you, sir, for sharing all your knowledge.
Thank you. Thank you, everybody from all the
forward for more sessions from you, sir.
Sure. I will definitely do what best can be done for the fraternity. So it's really a privilege for me to attend this session because I think this was my first session in the Middle East countries. Previously, I'm doing for other doctors also. And moreover, I do expect that whatever best can be done all across the globe with Dr. Henneman's science should be done. It should be delivered to the best of all to the humanity. Thank you. Thank you so much once again, Dr. Ritu, Dr. Sita, and all the people who are the part of this wonderful group.
Thank you, Doctor.
Thank you, Dr. Sita, and thank you, Dr. Bindra, for sharing your time. I would like to just say something about the Homeopathy Middle East. We recently launched the Insta of Homeopathy Middle East. So for future webinars or any other events, you all can log into and connect with the Insta. I will just put the Insta handle on the chat box, and also the YouTube channel where you can access Homeopathy Middle East future webinars or other activities. And thank you so much for all your time. I appreciate your taking out time today. Thank you so much, Dr. Bindra.
Thank you. Thank you. Thank you so much.
I will just type this chat box. Thank you so much. With this, we wind up the session. I have put in the chat box the Insta handle. Thank you.
Okay.
Okay. And for YouTube, you can just type in Homeopathy Middle East and log into all the sessions which are there. Thank you so much. Okay.